Good morning and a very warm welcome to this meeting of the kick-off Super. My name is Arjan Theil and I'm member of the board of GGZ Centraal, in English GGZ Central. And also a very warm welcome to all the participants somewhere in Germany, I heard in Denmark, Belgium even. Very warm welcome to our neighbors in Belgium, of course. Also, a very mixed audience and participants of backgrounds. We have people who have the profession in healthcare. We have technical wizards. I hope that there are people who have mental problems or had mental problems who can help us think about the future and participate in this way to come to the next generation of healthcare, because that's where it's all about. Let me first introduce GGZ Centraal. What are we? Well, we are now in a church. And that is, for some people, a very comfortable environment. And for some people, it is something of the past or of another culture. I think that is the metaphor we can use today also. We have to think about our heritage in healthcare and mental health care, but we have to step to a next generation of healthcare. And we must not throw away the key elements that are in healthcare and mental health care, and that is connecting. That is making the world better together. So, if we are talking about super, that is what it's all about. And it's a high goal, but I think today is an important step in achieving that. So, I'll leave you to that with this very big goal. Let's move forward to the next generation of healthcare together. And I'm immensely proud, of course, of all the people who are in GGZ Centraal, but also around us, to go to this goal. And first of all, that is Yvette, and she will talk to you after this. Thank you very much and have a very nice day.
Thank you, Arjan, for your nice words and the confidence I always get from GGZ Centraal. Let me introduce myself. I'm Yvette Roke. I'm a psychiatrist at GGZ Centraal since 2001. Yes, I'm very old. But also since 2018, I switched from the medical model to a much more supporting and coaching approach. And I find this very much more rewarding than working just in the medical model. And one of these changes I made is using co-creation in every step of the things we do and help the people I'm working with to change things in their daily life the way they would think would help them. So to do this and put them in their strengths, it gives you a lot of joy. And you see another person in your office instead of you being the doctor and telling them what to do. So this is for me the best way to work. And I hope I will inspire you today and get you enthusiastic about this way of working. And together we can make some changes in mental health, because that is very much the goal we need to achieve, I think, because we have huge problems with too many people working in the mental health care, long waiting lists. And I think using the strength of the people we are helping is one way to gain a lot. So now I want to go to the other slides, because I have to do two things at a time. It's mostly not very good, but This is the program of today. First we will introduce our project Super, and we will do so with a various number of speakers. And then we will go to the Task Force Healthcare and their expert speakers, and we will end the session of today with a panel discussion, moderated by Tom. So you are here today because we want to kick off our European project. It's called Super in Digital Mental Health. And we would like to welcome you on this collective journey and thank you all for joining us today. And a lot of people already said they would help us because they became a member of our expert pool. And I will explain a little bit about our expert pool. We want to engage as many people from as many backgrounds as we can to help us think about co-creation. Because together we can make a difference, and you cannot achieve these things alone. You need the clients, but you also need all the other stakeholders, the SMEs, the entrepreneurs, other mental health organizations, health insurance also, Knowledge Institute, patient federations, and our branch organizations. So if you haven't yet joined us, we have already 35 people joining us from 5 different countries. But if you would like, join us, email us, and you will be a part of this great journey we're going to take with each other. It will take you 3 hours in a period of 18 months. So this is not too much. I think you will manage that. So please email. Now I will give the floor to Femke. Where are you? Ah, there she is. I'm very proud to announce you. Femke is our project advisor from Interreg Nordsee, and she will tell you a little bit more about Interreg Nordsee, who granted us this project.
Yeah. Thank you, Yvette, and very nice to see all of you. So I'm Femke, and I'm here together with my colleague Christopher. We both work for Interreg Nordsee. I'm here mainly today to welcome you into the Interreg family. Not just the partners, but everybody that will work with the Super project. And I say family because Interreg is not just Interreg Nordsee. Interreg is a big funding tool from the European Union that funds projects to create positive change in the EU. Interreg has about 100 such programs that work and support and fund projects in a lot of different sectors. Interreg has programs that work work cross-border, so that work with 2 countries and support projects there. And there are Interreg programs that work what we call transnationally, and Interreg Nordsee is one of those. Interreg Nordsee funds projects along the coast of the North Sea, which is quite broad in this perspective. So you can see the region that we fund projects in and support for positive change in the EU. So that goes from Norway down all the way to France. Norway, as you probably know, is not official an EU member, but contributes to the program. We're very happy that now GGZ and also the other partners of the program are now part of this Interreg North Sea program, and we're very happy to and looking forward to see the change that this project will make in the mental health sector. Thank you, Yvette. Good luck.
Thank you, Femke. Then I will go to describing what the project is all about, because you heard now about our project. It's called Super in Digital Mental Health. Successful user participation examples, 2 apps. The SAM app, I will tell you a little bit more about the SAM app in a bit, and the SAFE app, and recommendations, the practical guidelines we will make about co-creation. So this is in short our project. And we have promised Interreg Nordsee, we deliver a lot of stuff in 18 months' time, so maybe this is a bit high achievement, but we will make it happen, I think. We promised to joint guideline development. So we make a guideline about how you go about co-creation in a practical manner. Then we will do 2 tandem pilots. Our SAM app, the Stress Autism Mate, co-created here at GGZ Centraal, will go to Denmark, be translated there, adopted there and implemented there. And their app, the SAFE app, will do the same, will be translated to Dutch and be adopted and implemented here. And then we can really see what went right and what went wrong, which are the challenges, and then we can make the practical guideline about this and write 2 journal articles about it. We promised to do a lot about communication, and we promised to do 2 public events, and yes, today, first one. So this is already a deliverable we made, and we made it happen. So this is in short what it's about. And now I want to go to the partners, and me, myself, I'm the first partner, GGZ Centraal. So Arjan already told you a little bit, but I will tell you a little bit about GGZ Centraal. Then Thomas Moore of Applied Sciences will introduce themselves as the partner we're partnering up with in this project. And also the Danish partners will introduce themselves and a little bit about design thinking and the app they will bring to the table. So GGZ Centraal, it's a mental health institute, the 4th largest in Netherlands, centered in the middle of Netherlands, hence the name Centraal. We have different locations, as you can see. It's just pictures so that you don't see where they are, but it's in Ermelo, a big place like this, in the forest with a lot of buildings. In Amersfoort, in the Flevopolder, Almere, Lelystad, in het Gooi, Hilversum, and a lot of different other locations, of course, because we are really big. We have outpatient facilities, we have psychiatric hospitals, we have a lot of expertise centers. So I will call HYPE, helping young people early, lifestyle, GGZ Hulp Online, the totally online part of GGZ Centraal. We have experience and center in movement disorders, and many others, also around personality disorders. We treat 28,000 patients every year. Every time I hear that number, I think, whoa, we are really tired. But it's a big number, but we do so with 4,000 employees. So GGZ Centraal is really large. But what do we stand for? And I put a few pictures of people here today or not here today, which I thought would be good to have in the spotlight. We do optimal clinical health service. This is why we work. This is what we do. This is our core business. But to do so, we also do education. Psychiatrists, psychologists, nurses. We do innovation. We do digital transformation processes. We do scientific research. And we co-create a lot. And then I want to go to the examples in co-creation. In this super project, we bring on our own co-creation. And it's an app. We make stress signaling apps. And the first app we made, and this is the app we will bring into the tandem pilot, is the Stress Autism Mate. It's an app to help people with autism deal with the stress in daily life. So not the acute stress, because we all know what that is. You get a scare or you get panic, and that's acute stress. But I think it's all about the chronic stress, the patterns of stress. The stress that will stapel, I don't know in English, it will grow. And then you have the acute moment. But you want to do something about the base. So the app asks you 2, 3 or 4 times a day what you have been doing. And 4 hours later, another question will come. It will ask you about your activities. And then it will give you 7 personalized, not personalized, but scientifically validated stress questions, especially for the people with autism. After this, the app will calculate with an algorithm what the stress level is. It will ask you if it's correct. That's really important. And then it will give you insight in your daily or weekly stress, and you can easily see where you were green, where you were yellow, orange, or red, and what you were doing at the time. And this gives people the chance to make some changes and use their own coping skills. So we don't want people to change their behavior, because that is really not really possible. It's really hard to get people to change their way of thinking and acting. But you can help them achieve the things they do good and use it better. And how did we make SAM? We made it by identifying the problem first. Because we asked them, what is the big problem in your daily life? And they said, the stress, but not the acute stress, but the stress in patterns. And then we asked them, how would you like to be helped to get a better understanding of this? And they came up with the idea of an app. And then we held interviews, we held focus groups. We also engaged, of course, the people treating the people with autism. We included their loved ones. And we just kept on trying, evaluating and sharing, first on paper and later on in a prototype of the app. We did it with 15 clients and their families. And after a while, I think 2 years later, they were really happy with the end result. And this was the Stress Autism Mate, the SAM app. So since May 2001, the SAM app is available in the app stores. And because the people helped us this much, we already had 1,300 people wanting to use SAM before it went on the market. And they were our best ambassadors. They helped us with the adoption and the implementation. So now we have a steady group of users of 2,200 people every day in the Netherlands that use SAM. We have over 40,000 downloads. And we have a gradual rise of the numbers since May 2021. We also have a panel of experts and users, a SAM panel. It's 300 members, and we develop with them. So the SAM app is not a rigid thing, it's something that's in movement, and we know what the people want, and then we try to incorporate it if we have the finances to do so, of course. The SAM app has a lot of all the things you have to take into account when working with apps. So I learned a lot, I can tell you, about privacy, about assessments by other app assessors. What I think is really important is also to scientifically validate the things you do. So the SAM app is scientifically validated. It decreases your stress levels by 30%. And it doubles their coping skills, and it increases your quality of life. So, and this is something, if you use it for 4 weeks, this is the case. And if you use it not for a month, you still will feel this way. So we have validated it in 2 different groups, but another group, who is not our group, that is the National Autism Register, has done an RCT with SAM, and they found the same result. So, yes. And co-creation is a lot of fun, but it leads to success sometimes, but also a lot of failure. And it's really challenging because you think you know what the other people would like, but then when you talk to them, you realize they want something totally different. So I didn't realize that they didn't like traffic light colors all the time because it's too stimulating. Or the green color is just a bad thing for some people with autism because it means understimulation. So they said we need also to choose whether we can use blue tones. Another thing, if the stress level was not correct, but at the beginning we didn't ask the question, they said we won't use this tool. What a bad tool this is. It says I'm stressed, but I'm not stressed. I just slept really, really bad last night. So we thought, well, we have to check with them how they feel about the answer of SAM and if it's correct. Luckily, it's correct 69% of the times now, so not a lot of wrong answers, but still the opportunity to say, yes, it's wrong. Then we thought we could help people not only by a daily or weekly insight, but how nice would it be if they have a monthly insight? Well, they didn't think that. They think it was too complicated to see in a month how your stress levels were and how your patterns were. A week was enough for them. So if we didn't know this, we made a totally wrong app. And if you don't like to co-create for the emotional rewarding part, you should co-create for the economically rewarding thing. Because if you incorporate all the end users' wishes, you have a high compliance rate of about 10%. So it's 0.3% for just a commercial app in the App Store after a week. So it drops. Then for the really good medical or otherwise apps, it's about 3 to 4%, the compliance rate. And with us, it's up to 10%. So this is a big reward also if you look at the waiting lists in digital mental health, or if you look at the economical benefits for a company. You should do co-creation all the time, I think. So this is the end of my talk. I want to thank my team also. If the slide will work. Oh, sorry. I'm a bit, how do you call it? Ongeduldig in Dutch. Impatient. So it's not only me working in the stress signaling apps, but I have a lot of people working with me. And today in the Super project, even more people. Nikkei is here from finances. Without you, Nikkei, we couldn't understand about all the financial rules. So thank you so much, and thank you so much to my team. And now I will give the word to Thomas Moore, and they will tell something about themselves. So Sylvie, the floor is yours.
So yeah, as I said, my colleague and I, Tom, and I are researchers at the Thomas More University of Applied Sciences, where we work at the Care and Wellbeing Expertise Center. So to give you a bit of information about Thomas More University of Applied Sciences, it feels a bit like bragging, but we're the largest university of applied sciences in Flanders. We have more than 20,000 students, 2,200 employees, 10 campuses spread across Flanders, and more than 40 bachelor's programs and 19 associate degrees. So that is actually the education part, but we also have a research part. So that's where Tom and I come in the picture in this project. So there's about 250 researchers, give or take, at Thomas More. And we mainly focus, or our research is mainly focused on practice. So our research is practice-oriented. We work together with the field, depending on our research domain. It's a clinical field, or it's companies, or it's tech, or depends on the center of expertise we are working for. So there are 9 of them. And we are working at the Care and Wellbeing Expertise Center, and specifically for the research group People and Wellbeing. So there's about 35 researchers, and we have 3 major research domains in our research group, focusing on assessment and intervention, effective prevention and empowerment, and the one that is most relevant for the Super project here, psychology and technology. With 5, there's 5 of us, 5 colleagues working on this research domain, so psychology and technology. And the research we do is really applied practice-oriented research. So working together with hospitals, with government, with tech developers, working on different kinds of projects. And we're also linked to our department of applied psychology, because some of our colleagues give a course there on digital mental health, and the project that we do as researchers are linked to augmented reality, virtual reality. We have a project now on virtual reality for relaxation. We also work with wearables, and the most important and most relevant thing for the project here is our work and expertise in adoption and implementation of digital mental health, so apps and platforms online and these things. So that was just really quick and in a nutshell what Thomas More University of Applied Sciences actually will do in this project. If you were to have any questions, you can always contact me or Tom via our email addresses, or just ask us a question here today, or you can visit our website, digitalmentalhealth.be. That's something I didn't say. We are from Belgium. So that was me and Thomas More in a nutshell. So I'd like to give the floor to Søren. Sorry. Here you go. I'm not sure whether you need it.
Right. The audio is working, so we are off to a good start. But my name is Søren Lange Nielsen. I work as a project lead in the Center for Digital Psychiatry in the region of Southern Denmark. And today, I'm here to give a very brief introduction, don't worry, to the Center for Digital Psychiatry and why we are involved in the SUPER project. But first of all, a very brief bit of context. Within Denmark, the healthcare system is publicly funded, where it is divided into 5 regions. And we are part of one of those 5 regions, where the Center for Digital Psychiatry is an integrated part of the mental health services within the region of southern Denmark. And our center is located in Odense, where we are roughly 80 employees working with digital psychiatry primarily. As a center, we work on 3 fronts. First of all, we provide national and digital services for the prevention and treatment of mental health issues. An example of this is our online clinic, where we provide free nationwide treatment for depression and anxiety using ICBT. Another example is our platform MindHelper, which is the largest platform information site for young people in Denmark, which has, I think it's roughly or just over 1 million visitors yearly, where you can find information and advice on everything from heartbreak to anxiety as a young person. But equally important, we develop and implement digital solutions, both with the local partners within our region, where we aid them to develop and implement digital solutions such as video consultations, virtual reality exposure, health apps, AI, and more. But we also work more on project basis with international partners and national partners such as the SUPER project today. But last but not least, we also have a research unit within the center, which is instrumental for researching and validating the effectiveness of the tools that we both develop and implement. And we have, I think it's roughly 15 researchers working in the center who primarily work, again, with digital psychiatry. And they are instrumental for the work that we do as a center. But we do all of this based on a vision of a digitally enhanced healthcare system, where the digital solutions are not add-ons, but they are integrated, are an integral part of the treatment and patient pathways. And to reach there and to come to that conclusion, co-creation is instrumental, as we need to know the actual needs of patients and users within the system. And that is also why we think the SUPER project is very interesting for us as an organization, and something that we want to help develop and broaden from our organization to the many other organizations working within digital mental health. And I think, in brief, that was me. I will give the word to my colleague Christian, who will tell a bit more about how we work with co-creation within our center.
Thank you, Søren. And do the audio works? Yeah, perfect. As Søren mentioned, my name is Christian Carlsen, and I work as a consult at Digital's Center for Digital Psychiatry. And I will briefly introduce a practical example of how we developed a service with design thinking as an underlying approach. And last, I will introduce the app SAFE that we plan to introduce. But first, here's an example of an elevator button. And this is why co-creation is very important. Just guess which button takes you up and which takes you down. This is often where we seize where co-creation is important, when it's bad and frustrating and a bit irritating. And this is why we work with co-creation at the center. Because we have to get the individual in the center, because we need to understand how we are going to develop a new solution for them. And that's why we are using design thinking. And that's the fundamental approach in our center. And I will give you a practical example of it. We designed a new service, a new platform, a website called MindApps, which is an app, a library of apps that has been in the quality assurance by us in the center. Here we started by empathizing who the real target audience was, because we could just say that who the target audience was. So we went out to former patients, we went out to app providers, we went out to the psychiatrist units and found out that the psychiatry staff actually saw the market for mental health apps as just a jungle. So they needed somewhere to go to see where they could get a new app for a certain patient. Then we started by defining what they needed in this library. And this is the service that we came about. We started our idea generation began on how we could develop, and we started by making a workshop with them on how we could manage to get this library done. And we then found out that they have to have an app library, and this is the app library, with filters, and this is the filters over here, that is closely aligned with their professional language, because otherwise it would not provide value for them to use it. So we made this prototype, and we tested it within the psychiatry unit, and this is what we came about. And we implemented it, and now it's officially, and it's out working. So that's perfect. But it's important for me to empathize that this has not been a linear process. It has been a very iterative process. We've gone back and forth constantly, and we've been working together closely to make the service as good as possible. And as mentioned, we plan to introduce the SAFE app, and it's also one of the apps that has this qualified quality assurance of one of the apps at MindApps. So SAFE has been developed with the same underlying approach about design thinking, and is developed in the region of Zealand in Denmark, and is currently on the stage for being implemented nationwide in Denmark. And SAFE has been emerged from a broader iterative to reduce coercion in the psychiatry. So user involvement has been a very broad thing in this project for implementing it, and has been used for troubleshoot and adapt the solution, and to see how the success was, and to document the success. And users have been very positive about the user experience throughout the app. Yes, I think, and we plan to adopt this app for the Dutch market, to translate it so we can use it in the project. Thank you.
So what I will do, I'll tell you just a little bit about Task Force Healthcare, and then introduce the rest of our expert speakers for today. My name is Wendy Hugoosgift. I'm a program director looking after our activities in Europe for Task Force Healthcare. Not here alone. We have our colleagues with us, Pieter van Beers and Lotte Hendricks as well. What Task Force Healthcare does is we really want to improve healthcare by connecting the right people. And we do that both within the Netherlands, but also in a broader scope. Where within the Netherlands, we really try to disseminate knowledge, connect the right people to see how we can strengthen, let's say, the healthcare systems, but also collaboration and interaction locally. And one of these masterclasses that we organize on behalf of the top sector, Health Holland, I think is a good example today. But also by connecting the right people more in a broader scope internationally. And in here we connect, let's say, the different ecosystems around the world, not only within Europe, of course we have a wider scope. And by that also tackling some of the more universal global challenges within the healthcare systems that we see, with a lot of demand, let's say, and but also a lot of power in creating the right solutions to face those. We do that not alone. We have a wide network of different companies, but also knowledge institutes, some university medical hospitals, and of course also our public partners that support us. Really, today, of course, we have a masterclass on healthy living, and with that also a link to mental health. And I just believe, Yvette, that this event itself was a very good example of co-creation on getting this together. And I actually just learned it was kind of a design thinking process we went through, where we emphasized during a trade fair in Berlin earlier this year. And I think we were even introduced by Merel, one of our expert speakers. And then, of course, we did some ideation and looked at what we want to achieve. And that was really more or less quite in line, I think, with the aims of the SUPER project in connecting the right networks and getting feedback and getting your project further in collaboration, and also for us connecting our networks to that. So that, I think, is how we came to this joint collaboration. And through that, of course, we also looked at, okay, who can we involve in sharing their experiences with co-creation in the space of also looking how we can support healthy living and mental health, beyond mental health, with innovative solutions. So I really want to give the word now to our expert speakers. We have Merel Scheffers, Chief Product Officer from Niceday, sharing her experience on co-creation and a validation of eHealth solutions. Then we also have Karolien van der Brekel, Director of Positive Health International. I think maybe known as a model. And she will share also more on her experience and how she networks and co-creates in her space. And then we have Jeroen Deenik, researcher also here, colleague of Yvette from GGZ Centraal. So without further ado, I would like to give the floor now to Merel.
Hi, perfect. Hi, I'm Merel, and this is my colleague Wouter. I wore a Barbie dress today, which was hard to slip in my microphone. Let's see. Kijk. So, to tell you a bit about me and about what Niceday is doing, I am head of product, which means that I am in the lead of the tech team at Niceday. We have engineers and designers working for us, designers like Christian. And next to that, we have domain experts like Wouter.
I'm Wouter Schippers. I'm a psychologist at Niceday, and I also work for the Soul Psychotherapy. So I'm both at the technical side and the content side of doing treatment.
Yeah, and as a head of product, it's my responsibility to align business goals of the company with input of users, with what we are capable to do on the technical side of the product. So my job is not always easy, but I love to do it. And Niceday is a treatment platform for therapists and a client portal for clients. Clients have a mobile app. We currently have around 35,000 weekly active app users, so clients, and we have more than 1,000 weekly active therapists in 6 different countries. But of course, we also face a lot of challenges when trying to develop a product. When we started the company, we discovered, shockingly, that for most traditional eHealth applications, 4.4% of the clients stay active after 2 weeks. So that means that, for example, they get sent a module, an eHealth module, and they are asked to follow this module, and only 4.4% of the clients are still active in this eHealth solutions after 2 weeks, which is, for example, because they feel that it's not personalized to them. They are just receiving a generic module that is not fitting to their personal needs. Next to that, research shows that most everyday practices are not easily translated into healthcare solutions, which means that what we see in healthcare is that healthcare solutions are steering the process in how you should work, but users are not able to steer how they want to work in a healthcare product. And next to that, for example, the European Commission is saying that there should be more research on how mental health care platforms are contributing to the effectiveness of care and how they are leading to better care delivery, which they currently are not able to deliver these kind of results.
Yeah, so of course why we're here is to talk about why co-creation and validation is necessary. I think as a therapist, co-creation has a very high value for me. In treatment we call it a little bit different. It's more in the terms of the shared decision making. And anecdotally speaking, I see that that is very beneficial for my clients. That's a personal example why I think it's very important. But of course, if you look at eHealth, there's other reasons why it's very important. We have a definition here why co-creation and validation is important. Is to bring in research, data, expertise to optimize a product to first tailor to the needs of the users. They are just very important. They're using your product. You can think of therapists, clients, secretary, administration, everyone. It's very important that they know how to use the product, like to use the product. The usability of a product is just very important. Otherwise, it's, well, I wouldn't say it's useless, but it's quite essential if you have a product. What's also important is that you tailor to the needs of organizations themselves. And an organization can be a practice, can be a research practice, a university, can be collaborators, so everyone that works together with us or wants to work together with us. But you can also think, of course, new regulations from government institutions. The field is always changing, so the needs change as well, and we as a product have to adapt to that. What's also important, of course, is if you're working digitally, you have to improve the reliability of data, but also the intervention that are there. Yeah, I don't want to explain too much to it. It's just very obvious if you work in the field of technology. And therefore, the most important thing, of course, is to facilitate improving general health, not only mental health, but just health in general, and well-being. I think a clear example of our co-creation as a product is that we share all our content, so the content we write for clients, but also the research we do is available for everyone, everywhere, for free.
Thanks, Wouter. Then put this down. So to summarize it, we discovered that collaboration is for us the most important thing that we can do to actually make a positive impact. Which is also at the heart of everything that we do in our company. It's not easy, it's a lot of work, especially for me, to align in and external stakeholders. It gives me some stress some days, to be honest, but it's always worth it. So our collaborative nature makes it possible to co-create. We co-create by doing user research and user testing. User research is something that we do to figure out what the problem is and what the problem behind the problem is. So what we usually notice is that users are saying, deliver us feature A, B, and C, and this will solve all our problems. It's my job to talk with these users and to understand why they're asking me this solution and what is the question behind it. to make sure that we are delivering the right solution to the right problem. Maybe sounds a bit vague, but usually you will notice that when you give people exactly what they want, it's not solving their problems. So it's up to us to understand what the real problem is and solve it in a way that they need. But of course, when we have designed our solutions, we have to do a usability test. So we have to understand, are you able to use the solutions as we designed them? They are full of assumptions from our side. And we need to make sure that we filter out assumptions and that we come as close to being sure that we are providing the right solution. Only then you can provide the right value to the user. We do this also, for example, especially when we are creating content together with super users and experts in the field. A couple of months ago, I was asked the question, for example, to provide content for ADHD treatment, which is not something that therapists that are working at Niceday are doing, which meant that we had to go into the field and talk with therapists at other GGZ organizations like Mondriaan and PsyQ to understand, and Sineda from GGZ Friesland, to understand when you're treating ADHD, what do you do, how does it work for you, what kind of content would you need to do this, to provide the right solutions. Next to that, we always validate and iterate. So my team releases weekly, which is not a common thing in tech. In tech, we usually release maybe 2 to 4 times a year, re-release every week, which means that every single week we iterate on what we did last week. We sometimes deliver features, and then after a couple of weeks we discover in our data that users are not using a feature as you expected them to do it. So, for example, we expected that a certain feature would be something that every user would adopt immediately and start using every day in their day-to-day practice. We see in our data that they are not doing that. So we made some wrong assumptions, right? It's then up to us to discover where we went wrong and iterate on it. So fail fast, learn fast, and get up your feet again. That's my job, usually. So I make data-informed decisions, and based on data, I try to understand what did I do wrong and where can I improve. I always learned to stay humble, because every week I still learn that I make wrong assumptions, I make mistakes, and that I have to learn from them. Next to that, I discovered that especially in the mental health care field, it's important to have an open data mindset. There are still a lot of companies that are keeping their doors closed to exchange data. That is, in our opinion, not how we are helping the clients the best. So we publish our open APIs, and we invite other companies to exchange data with us to be able to treat patients in a better way. Next to that, when you, of course, provide mental health care solutions, you have to research about treatment efficiency, effectiveness, and cost effectiveness. That's not something that Niceday does by themselves. We do that with a lot of research partners. And we do that, for example, for specific fields. Currently, we have research running, or a research project running for, what was it, Wouter?
Which one? Tell me.
For specific diagnosis. Bipolar disorders?
Bipolar disorder, the percentage?
I think I remember.
It's really
We have research running for the predictive values of a new bipolar episode. Next to that, I think most important research that we have running currently, and it's most close to my heart, is the research for the usability of explainable AI to improve or to help the therapists with the decisions that they want to make. So we work together with a couple of other partners to provide explainable AI to the therapists to help them with making the right decisions during treatment. This is a project of years and years, but we kicked off a year ago, and I'm very excited about it. That was it. Jeroen? Oh, Karolien.
I'm very honored to be here today. Maybe as a general practitioner looking broad at health, I have a different scope of this morning. I already learned a lot. Connection, co-creation are the words. Yeah, I'm a general practitioner working here in Utrecht. And as the first speaker, Yvette, you said, I started also change to work differently because I got frustrated about words as prevention, words as, yeah, I think with the medical model we try to solve people, we come up with a repair reflex and try to solve things for other people. But how can we solve as professionals things? I mean, 24/7, people have to take care of themselves. So I started to think, talking about health, I started to think about putting the patient central. And then positive health came up into my world, and I thought, this is what it is. This is what I need, and I started to pioneer with it as a general practitioner. And also locally, regionally, nationally, I worked for the Institute Positive Health, which established positive health in the Netherlands. And now since last year, we enable the movement abroad, because there's a lot of questions from abroad. Also our guests on the live stream, we have some implementation in Belgium and Germany, and start with webinars in Denmark. So I hope this will also be a start to bring this forward, because I think it really works, and it makes doctors happier, patients active, more empowered, and it's even good for the care costs, because people start, you know, the whole mental care. I have so many patients in mental care, and they're waiting for 9 months, and I think, what are they waiting for? Let's have a different conversation. That's what positive health is about. Connection. You first need to connect with yourself before you can connect with others. And I think this could be, positive health could be the bridge between all those great digital solutions I hear about today, and the trusted value of the professional world who have knowledge about what's important for the patient. And yeah, we could be a bridge to support people and say, okay, what do you need? And then we can see what all digital solutions are there if people are willing to find the digital way, or maybe they have other solutions. But before I start to talk about positive health, just a quick check-in. Did anyone, for who is it new? Who didn't hear about it at all? A few people. Yeah, so I do a little broad, a short start with it to make sure that you're also connected. Who already works with it? Who already has positive health conversations? There's also a few of them. And is anyone who could share and say, okay, this is the added value of it? I think I heard it already from you, but maybe someone there. What does it bring you as a professional to work with positive health? Anyone who would like to share just a few words? Can you tell? Yeah.
I think the starting point of the conversation.
The starting point of the conversation. And what is different?
So I think when you use positive health, then at first you ask the patient, the person, what he wants to talk about.
Mm-hmm.
And you take that as a starting point instead of that you, for instance, summarize where someone's here for and take that as a starting point.
Yeah, so the starting point is different, and it starts. Exactly, yeah. Every time again, I'm surprised what people come up with for solutions, what they can do themselves. And as a professional, and this is how we brought up, this is how the whole educational system works, so nothing to blame, but this is really, it asks for a mindset change. And I think positive health could support a mindset change for professionals, and that's where Positive Health International is for, to train professionals to know how to work with it. Because it starts with yourself. If you start to work from out of what do I need, what is important for me, and also sit next to the patient more side by side and discover from out of curiosity what is it what you need, it really supports people and empowers them. So that's what positive health is about. Very short summary. It could be a solution for some health challenges today. It's a well, new concept. In the Netherlands, we already have it for more than 10 years. But this broad perspective on health, not only the absence of disease, but looking what all is there. And this is also meaningfulness and quality of life and being able to do your daily thing. That's what health is about. It empowers people with the ability to adapt and to self-manage, to really promote the self-care. And of course, in co-creation, we need a lot of digital tooling for these things to support them and see what do you need. It supports and empowers to resilience. And the spiderweb, that's a tool, that's a very practical tool, which is a great starting point for the conversation. And here there's a few things. It supports also this movement from more disease-oriented to health-oriented care, and the other things I already said. And very short, it started 10 years ago with research from Machteld Huber, the founder. She made a publication in the British Medical Journal about the definition of health. And it's the health is the ability to adapt and to self-manage, to deal with the challenges of life. And this could be physical, this could be mental, very often mental nowadays, emotional, social. And all these things are important for people in life. And this simple tool supports people. I ask them many times a day as a general practitioner, I ask people, can you fill in? You only have to give yourself 6 numbers, or you can fill it in online. There's a simple version for people with low literacy. There's all kinds of versions for young people, children. And then we focus on what's important, as you said, the starting point. What is important to you, and what is it where you want to start with? And this is something you can do yourself. Is there something you need? Is there something in the way? Here on this mental care focus, I had a patient who said, I was 10 years in mental care. I had many professionals. I wasn't able to make a change. And then I got positive health on my track. And then the main question was, like, what is it why you're not able to do what you want? There was something in the way. And these were all kinds of things in her past. And then what is it what you need to actually overcome this? And she said that question supported me to empower myself and to be able to take my steps. And now she's like a positive health trainer. She's like totally flourishing. And well, of course, the problems of her youth are not gone. But it's really powerful how that really worked for her. So this is simple too. I use it daily in my work, but many people can fill it in themselves. And it's 3 elements. You fill in the spiderweb, you have this different conversation. It could be with your professional, but we also have community centers where inhabitants have this with other inhabitants, so it doesn't need to be specifically professional in medical care, social workers, etc. Many other professionalities. What really matters to you? What is it what you would like to change? And then the 3rd step, what actions are you going to take? And this is exactly where here we come to co-creation. Like, it's great to have all those different possibilities, digital, but it could also be something, sorry, just take a sip of water. It could be digital, but it could also be like having a cup of coffee with a neighbor. It also, like the next speaker is about lifestyle and about getting into action. It really can support. I have many people getting into lifestyle changes where it starts with a positive health conversation. What is important? What is it what you want? I want to be able to go with my grandchildren to the playing ground. Okay, so what is it what you need? And then it's not that you say, okay, you have to move or you have to quit smoking, but it's like, what is it what you want? And I also, and maybe you'll tell a little bit more about it, Jeroen, I think it's important as a professional that we give the good example, practice what you preach. And it doesn't mean that every doctor needs to go walking with their patients, but I'm next to someone, so the patient is the expert about their life. And I say, well, okay, I also have some challenges with either young children or whatever. How can you incorporate daily, healthy living changes into your life? To take the bike to work or whatever, it could be everything. So I also put myself as an instrument, as a role model, and I think that also really supports to make, to support the patient. But that's, of course, everybody has to find themselves if they want this. We have digital tooling, and I think that's what it is about, but we also have them on paper. As I said, a simple version. And this is then the actions. What step can you take after the conversation? We use a lot the GGD App Store in the Netherlands. They have on all 6 dimensions a next step available. But I already heard about great new apps today, so I think It should be definitely broadened, and also for the international market, I think it's very good to know what all kind of apps are free available, but also what all kinds of apps have a good quality, and really support people to go to the next step and see what they can do. So, very short summary about what we learned from Positive Health in the Netherlands. You can use it on individual level, so one-on-one. You can also use it in organization level, on teams. So, as people, we all work probably somewhere in a team or a practice. So, do you fill in Positive Health for yourself? Do you stimulate each other about working healthy, being vital, employees, etc.? And how have you anchored this in your policy of your work, of your company? But in communities, we have a lot of resilient communities. So how do we work together with all? There's so many silos that everybody's doing their own thing. So how can you have really a shared vision for a community? You know what the problems are, and you know, if everybody is a puzzle, part of the piece of a puzzle, we can support each other. And Positive Health is really a shared language to see and collaborate and co-create within communities, even in regions and in countries. And we're proud that in our Dutch National Health Policy document, Positive Health is kind of as an umbrella, where, of course, it's really important to know what underlying problems are. It's important to cooperate with other colleagues, professionals. And yeah, this is a way of looking, I think, for the future, a really important fundament could this be for looking differently from out of the health-oriented focus. So what do we do as Positive Health International? We have trainings, workshops to actually train professionals. This is the old-fashioned way live, but we also will do this with e-learnings to reach our international interested people to start working with it. And maybe good also to know, the last slide is we have the Positive Health digital tooling available for, sorry, this is in Dutch, for inhabitants. So there's a free way for everybody to fill in the Positive Health online tool. We are busy with translating this in different languages. It's available in English, but it will also be there in German, hopefully, and other languages later. There is an organization platform, so that's for all the people who want to have this in their organization, and also have a dashboard with feedback about who fills in Positive Health and what are all the challenges and actions to start from there. And then there is a national platform you can, so organizational and within your own software. So there's a little, it's all starting now in the Netherlands to bring this forward, but there's a lot of opportunities for the future to co-create and see how we can work with Positive Health also digitally. All right, so, well, this is just a short summary. If you are inspired, you want training, we have a handbook, Positive Health. We have flyers, and well, if you're interested, I'll be here afterwards to give some more information about it.
I'll take this one. So I will close this off, this expert part. It's interesting to see who the experts are here. I think most of the experts are at other places here today. Well, I'm Jeroen Deenik. I'm happy to talk to you about a part of scientific research in mental health care, especially in this institution. And I'm happy to stay here as well on behalf of other great colleagues sitting here and working hard at other places today, because it's a really nice place to do scientific research, also challenging because it's exact on the line between daily routine care and the academic field. And it's much more easier to complete the one or complete the other, but it's a challenge to combine it, and I think it's a really good place to do that. My background, I have a background as a psychomotor therapist and health psychologist, and it's therefore also not surprising that movement and physical activity and lifestyle is a topic that suits me and really catches me when working here. So I'll talk to you a bit about lifestyle in psychiatry, which is really our main topic of our research stream. and we're working on a daily basis with co-creation. And I can also speak on behalf of other colleagues that I think psychiatry is especially, we just wrote a grant application for healthcare in general in the Netherlands, but if you look at psychiatry, we're really used to do interdisciplinary co-creation. We work on a daily basis with psychologists, psychiatrists, people with lived experience, managers, team leaders, etc. And we have to deal with it all to make a change. But I wanted to highlight one thing, and that's our own part in co-creation, because it's still a pitfall to think that, we are trained as being the experts in mental health care and we talk with our patients, and then we think co-creation is asking the patients what they want, what they need, and adapt the interventions to it. But we sometimes forgot that we are part of this co-creation, and that we only can co-create if it's an equal conversation and equal intervention. And sometimes it may be better that the intervention more on us than on the patients. But I will tell more about that. So what's the important thing about lifestyle psychiatry? Like you saw, it's a bit popularized term now, lifestyle psychiatry, which basically has its origin in the disadvantaged physical health of people in mental health care. So people in mental health care die up to 20 years earlier than people without mental illness condition, basically due to physical health conditions like diabetes or cardiovascular disease. So that's still important, but it was also kind of discussion, which is interesting in kind of co-creation between disciplines in mental health care and healthcare in general as well, because we're all trained to treat mental health care, not a physical health problem. So it always has been a discussion whose responsibility that is. But it's still an ongoing topic we need to focus on. But the discussion ends when we look at all the lines. It's a bit of a complicated figure, but just to visualize how many lines we know based on scientific knowledge, there are direct relationships between all these lifestyle behaviors like substance use, sleep, physical activity, nutrition, in not only treatment but also the onset of mental health problems and symptoms. So we really can improve this. And like I said, I will highlight one thing of this, and this started in the early days here 10 years ago. We did our first objective measurement of physical activity, and where we were all thinking, we need to help the patients to be more physically active and thinking about interventions, etc. But it was the first time we did this with objective measurements, especially in severe mental illness, which I focused on most, so psychosis, severe depression, bipolar disorder. So we really focused on the patients. And then we did this for the first time, and we had no scores to compare it with, no people without severe mental illness. So we also measured our employees, and this was very surprising, and for a lot of employees, and a lot of patients were really laughing at us because they were asking, who is telling who something about health and change? So maybe we should change together. And this is strengthened by recent research in recent days. So what we did was also measurement at the annual Congress for the Psychiatrists. We asked them to do a fitness test and to ask them about physical health treatment and lifestyle treatment in their practices. And it turned out, and we are currently repeating this on a large scale, national scale, with one of our PhD students, it's confirmed that the clinicians who are more fit and more into lifestyle are actually more discussing this with patients and having the conversation, actually referring people to these treatment opportunities, which are protocol, for example, for depression. So next to antidepressant treatment, it's in the protocol to describe exercise, for example, exercise interventions. But it still depends on significant partly, on the fitness and the lifestyle and the behavior of your clinician, whether you're referred or whether this team is discussed. So that's major pitfall still, and we see researchers are really happy with these kind of papers, and it's great you're in The Guardian or other great newspaper with your research, and we put in such pictures. And then you see the response of patients on this research and on these developments. And because it suggests, especially in lifestyle, which is really a culture thing as well, that it's easy to change. And we asked people what they need. Well, they need a physical activity intervention. We developed it. It's very effective. So you should do physical activity, end of discussion or conversation. What can we do? So what we did here in the inpatient facilities was another way of working. So it was really culture change. So basically where it's all started, learning about co-creation, it wasn't about apps or digital interventions. It was just working in daily routine care. And one important part of this was the co-creation. So in the so-called patient staff meetings, they discussed what should be the daily program. What kind of activities do you want to do? What should we do with the nutrition? What do we do with eating and sleeping and medication, etc.? And after a year and a half, we saw significant change in physical health. We saw significant change in medication use, a drop in medication use. We saw improved psychosocial functioning, and especially the social part of that functioning. And what patients said, it was really helpful to have this equal way of working with the staff at the ward, who also were there in training clothing and just walking and also having some dietary advice, etc. We were all doing it together. So great results, which is good, of course, and fun as a researcher. Basically, also mainly the stories from the clinical practice are really helpful and motivating. So 2 examples of both parts of co-creation in success and failure. When you look at the picture on the left, it's today completely opposite weather. But if you look at it and you plan to be physically active, maybe, I don't know what your feeling is, but maybe I think, well, maybe I should be inside waiting for the rain to be over or having a sunny day, and then I will do my workout. So the culture was changed in that way, and in co-creation on that kind of level, that the psychiatrist was exactly thinking this, although she promised to do the walk together with the patients. So what was happening is that the patients came down from the ward, knocked on her door and said, well, we're walking, right? We also don't like this weather, but we're in this together. So come on, no excuse, we're going. Without an umbrella, doesn't matter, it will be all right. So that was really a good motivating example, and also to see that we as mental health care professionals are also not very fit often. Most of the times, sometimes, patients had a better physical condition when walking and running than the mental health care professionals. So that was really a good change. A major pitfall was then with the elderly people. The team was really eager to do something on lifestyle and said, okay, we shouldn't do all these coffee in the evening and all the Coca-Cola all day on the table at the ward. So we put in some water and tea and caffeine-free coffee at night. So, of course, great intentions, but a great discussion as well, because this wasn't a conversation, it was just happening. So they were really right, the patients, to complain about this. And what they did was a conversation about, okay, what should we do then? So then it was a backwards co-creation, because that was certainly a mistake. And then they discussed what were the options to have other drinks at the table. And then it turned out, with also our facility managers, that there was a possibility to have these kind of bottles of water with fresh fruit in it, a nice fruity taste, but it was always an option. So the patients were really surprised and said, well, if we knew this 5 years ago, we would have said, yes, we wanted this. So also not discussing other options, because we think, well, there's Coca-Cola, they're drinking it all day, they like it, so we should keep it. It was really a really good wake-up call, again, that people were more asking and more initiating co-creation than we were currently doing. So this all changed, and now every ward, we have the great project here at the inpatient wards as well for cooking together and with new facilities, etc., in which patients were included in all the discussion and the conversation. The opposite in terms of age is that we are now also working with teams with youth mental health care, for example, and the mental health care professionals are really struggling about discussing this topic of lifestyle with them, which is interesting because especially in that age, it's really a topic. People start to smoke or experimenting with drugs or alcohol or sleeping not well, etc. All the developments physically going on. So really interesting, but all the flyers on paper are really boring, discussing, do you drink? Yeah, I drink sometimes, just shut up. And it was not really a nice conversation. So now we started a project within GGZ Centraal, and it's really a success now, developing together with these patients the psychoeducation in a digital tool together with a company who is really into gamification, etc. So really now going on with the prototype now and see what we can manage to develop this further, which is really a great example of the other side of severe mental illness, which is really asking about new things. And a more structural thing is that we did this all in inpatient facilities, like I said, with great results, and people were asking in the implementation research we did. We interviewed all patients like we did with the mental health care professionals, and they asked for, well, I would like to implement this more into outpatient healthcare, because I'm really improved now in the clinic, and now I go outside and it gets worse and worse. So all this input in the research we did, all this input we had from interviews, but also clinical experience, was really leading to the organizational change and led to the point that in GGZ Centraal now lifestyle is a really central thing in all the things we do, in the strategy of the organization. Also, what's the direct implication of this was that we developed now GOAL, which is a support in outpatient healthcare, which we continuously work together with all the patients there, who give really good input to shape this intervention to something they really benefit from. Some other thing, because it's just information for you, if you want it, I can share the PDF. It's just not about all GGZ Centraal, but we also work together when it comes to severe mental illness with University of Twente in the northeast of the Netherlands, who are really working now. We tried an app because it was really tricky, because especially in the long-term severe mental illness, digital literacy is really low. But we tried an app to improve self-control, which can stimulate, is a theory, the behavioral change to accomplish your goals, to set realistic goals when it comes to being physically active or doing any goal you want to change. And now there will be a book about design thinking, etc., for in mental health care, and we also wrote a chapter about co-design specifically for severe mental illness. So really much developments, also learning us as mental health care professionals how we can do this better. COVID times were really complicated and sad, but we tried to use this positively. And like you see, if you want more information, most of the time I use this sheet to see if you want more information, you can just look at it. All information about lifestyle psychiatry, mostly Dutch, I'm sorry. But the thing here is that almost everything we developed together with patients and people with lived experiences and their parents and relatives, for example. So the book on lifestyle psychiatry, the Dutch version of it, also stories of relatives of patients themselves, also in other educations, and some cases we used to give examples for mental health care professionals how they can achieve behavioral change of improvement. So that's really, well, gives me a lot of energy to do so. So ending with a picture of the walks initiated by our patients. I thank you much for listening, and if you want more information, you can always contact us. Thank you.
Question and answer round right now. So you've been doing a lot of listening right now, but I'm sure some of the presentations have also triggered some questions for you, or maybe you want to share your experience. So I want to give the floor now to Tom van Dalen, again from the Thomas More University on Applied Sciences.
All right, perfect. Thank you. Yes, my aim is to facilitate this Q&A, and as I've been sitting in the audience with you, I've seen many of you taking pictures, taking notes. Questions probably have arisen in the meantime. I just wanted to share like 2-3 lines of thought from each of the different talks that I thought were particularly interesting or relevant. I think when I heard Merel and Wouter talking earlier, I think it was an important point that they made was the importance of collaborating within the sector, being open and transparent on the type of data and information that you gather, because they believe that if you allow this type of collaboration of creating together as an industry for patients, for clinicians, that will probably lead to better quality, to better care, to better products. I think, Karolien, what you said, what resonated with me as well was that positive health is really about taking indeed a different starting point and considering the patient's perspective first, and also discuss with them what they consider health, what are their options, what are their future endeavors that they could explore together with your clinician, with your physician. And Jeroen, to be honest, it was a fairly inconvenient truth for myself, considering my own physical fitness or lack thereof at the moment. And also the practice what you preach aspect of it all, not just listening to what people want, but also demonstrating that you could do this collaboratively. And also I think what I liked as well was the fact that you shouldn't think that because something currently is good, that it couldn't be great, and that you shouldn't explore rooms for optimization and improvement. So these are just some thoughts, and I also have some questions, but I could go rambling on. I would rather hear them from you. So I was actually wondering, does anybody have any questions for the speakers right here and right now? If so, just raise your hand and I'll gladly give you the mic. Let's see, anyone? I'm always told that Dutch audiences are very participative, but this is quite tends to vary. Yes, all right. Thank you for being the first.
Okay, I'll try. My question is to Karolien. My name is Carlos Cruz. I'm the founder and the manager of Digital Poly in Centraal. We work nationwide, and basically, of course, what we would like to do is help as much as possible people, you know, with mental health care. What we do find, what triggered me is that you're a general practitioner, is that when you're talking about, you know, positive health and how you want to help them, and digital health being something that really works, I hope that my colleagues in Denmark also have the same experience. We do find that some not very positive ideas about digital health is mainly maintained within the general practitionership. And my question to you is, what do you think, or how do you feel like what we could do in order to make that step smaller or faster for general practitioner to maybe refer more towards digital health?
Yeah, good question. I recognize the challenge. I'm always enthusiastic about what works, and then I have, in my opinion, a quite conservative group of colleagues, and of course there's many of them who are also innovative. But you know, if someone brings the solution and say, okay, you should do this now, you should do digital health, then it's mostly like, well, I will decide myself. But there is a lot of urgency now. So we have really problems. We have a lot of people burn out. We have practices where there are no doctors. So there is a lot of urgency and also awareness that general practitioners, or I see it everywhere, also in other countries, the healthcare system needs to change. There is health transformation going on, and there is a need. So there is in our we have more time for the patient. Is for the GPs in the Netherlands one of the focuses where we have digital tooling as one of the 4 interventions, and having this different conversation with positive health is another one. But what I think is the mindset change is the most important. So we need more people going on the stage and saying, okay, it's going to support you to look different. You really don't think that you have the solutions, but that you can do this together. And I think this is also, if you sit together with the medical group and say, okay, what is it what you need? We're going to support you to make sure that you don't have to come up with the solution for the patient, but that having a different conversation, you can just easily look what's there into them. So that will be my suggestion. I don't know if that's an answer, but yeah.
Thank you very much. Anyone else? Yes, perfect. We're getting things rolling now, so that's...
Thank you. First of all, thanks for this amazing morning. And I have a question to Karolien as well. I'm working as a social worker, and we also try to work from the positive, healthy way. And we use this, in Dutch it names oplossingsgericht werken, dus oriented way of working. And I try to understand which is the difference between what we are doing and what we do as a social worker in this method. I don't know if you know the method.
Yes, I definitely know it. I think it's all like oplossingsgericht werken, solution-oriented working. No, is it? Yeah. And it's all the same, how do I say? We all want the same thing. We want personalized healthcare. We want to support people to find their solutions. And also there you need a perspective shift that as a professional, you're not the one who's going to tell what's good for someone. So in the past, I always had like many brochures and advices and say, oh, why don't you do this lifestyle program? Or why don't you go to this and this person who has great experience with that and that. And with having different, like also exactly solution-oriented questions are great. Like, what is it what you hope for? That's the great question. Like, it really supports people to think about what they want. And they become more active about, oh, do I have to think about something? Oh, and then I see a glance in their eyes, and their eyes are twinkling. It's like, yeah, now we got it. Okay, what's the next step? What change would that make? And then they say, okay, well, then I would do this and this and this. I'm like, wow, great. So what's the next step? And so even with positive health, or with, it's all a part of the same focus, and it really synergizes. So.
Thank you. Okay, so as we're all aware, some people are actually joining in remotely as well. So I've just received feel very much like a talk show host now. I've received a live chat message from Merel, who was wondering, Jeroen, about the book you've mentioned regarding design thinking and mental health care. She was, I think, very curious about that book. She was wondering what the name is, or whether it was a part of the lifestyle psychiatry book. So. Yeah, your mic's there, so yeah, you go right ahead. Sorry.
Well, I can send it to you because this was a concept. I currently have the concept, and I heard from the publisher that the title would change. So I can name now a change, so, but the title, but I don't know what the final title is. But I think the book is almost finished. But I can just look at it. But it's not part of the lifestyle psychiatry book. It's a separate book.
So, Merel, if you're out there, which I assume you still are.
Yeah, I'm sorry.
There's a book on the way. Perhaps also important to note is that we'll be sharing handouts of the slides. So that might be an interesting starting point to either find information or reach out to the different speakers as well. Anyone else? Yes, perfect. Let me find the shortest way to you.
Yeah, thank you very much for all the speakers. Caroline Hummels from the University of Technology in Eindhoven, from a design department. I was wondering, I don't have a specific speaker in mind, but what is the role of courage? Because we have a certain system, we have a certain way of working. I think, well, I know Yvette very well. She's, in my opinion, a very courageous woman, because she stands up to the system, and you really have to carve different ways than are currently there. So I was just looking at the perspectives, how do you deal with that?
So who has the courage to take this on?
Maybe you, Tom?
No.
I would love to jump in, but I already said a lot of things, so I would give the space to my colleague.
Or maybe I can, but also, shall I answer?
If you're courageous.
Yes, I think I am. So thank you, Karolien, for your question. Yes, I think you need to have a bit of courage, because you are swimming against the current, because you want to do something different and you have a different mindset. But then I think I never had a really good fit in the system I was working in. So I think at a certain point of time you feel enough maybe pain or need to change, and then you find your own way. So I don't know if courage is, it's courageous, I think, to set into change. But if you do this and you have energy and you're enthusiastic about it, then a lot of people will follow. And so that is very rewarding. And all the other people here today, I think, are really courageous too, to follow this kind of change. Is that a good answer? Oh, no, you're not satisfied? I know you.
No, of course I'm satisfied. But then I get, of course, into the next question. Are we all outliers? And how to get people involved and that might not have had your background in rowing against the stream and seeing about all the stuff that you do in the positive health. So how do you get the people in so that it really will spread? I don't know if you have any thoughts on that.
I have thoughts on that, but maybe somebody else, if you want to answer, please raise your hand. But I think that if there is a need in society, and I think there is, then people see the perspective, and they also know that a change is needed to get somewhere else. So if you see one person do something, then you think, well, maybe this is a good idea, and I will follow, and I will do the same. So in my case, my clients with autism, they weren't really that technical because the age was, this was a surprise to us, but the mean age was really high and some people didn't even own a smartphone. So for the project to make the stress autism mates, they just got a smartphone from us. And during the project, they purchased their own smartphone because they really liked it and they had made the change. And the people in their environment saw them changing, and that inspired them. So I think you need a good ambassador or a few good ambassadors to give the right example, to see the benefit they have, and to feel the enthusiasm they also have. And then it will spread and it will follow. So I think we have to inspire everybody in this way. Oh, there. Shall I walk, Tom?
Lange, Games for Health, probably known to you, also based in Eindhoven. I was wondering, I actually had a question on this, but I think that's also the answer to the solution. I think the answer to the solution is to make a proper stakeholder definition and then the appropriate stakeholder selection. And if you have the appropriate stakeholders, the definition is difficult, but if you have the appropriate stakeholders, you will automatically have engagement. That was I'm missing in all the presentations on co-creation. Stakeholder selection is the first thing to start with.
Somebody immediately had a thought on this, so.
Yeah, I think it's a follow-up on both of the first speakers, but I'm Madelon Brakke, I'm co-founder of ClearBio, and I'm not in the mental health area, but I'm really in the diabetes area, and we provide data-driven personalization on food advice. And I think in addition to the stakeholders and to go show the good examples, I think it's also important to measure. So if we have data to show what works and what doesn't work, we convince all the people who are a little bit, well, afraid to take that first step. And well, as an example, we last week got our first contract with a healthcare group who's now going to prescribe Clear for people with diabetes. And other healthcare groups say, oh, they're already doing it there. Well, then the step is a little bit less big. And I think with measuring and showing what works, we also have another angle in addition to the stakeholder mapping and, well, having the good examples in quality, also in quantity.
Perfect. Thank you. I'm getting overwhelmed a little bit.
Thank you. I'm Sam. I'm a colleague of Wouter and Merel. And I think all mentioning here is good. We need courage. We need people who are game-changing the entire medical world. But shouldn't we focus on education as well? So I heard universities here and start teaching new professionals that we need to change the world by using technology. Is there any thoughts on that?
being a representative of higher education here, let me quickly say that yes, indeed, although we notice that it's actually quite challenging to implement this within curricula, as they most of the time rely on fairly established programs with also the professional workforce, professors essentially having their own domain-specific expertise and making that transition and shifting. I mean, putting something in often requires pulling something out, and that proves to be quite challenging. So we do see that most of the steps being taken at the moment are not in the initial training of future healthcare, mental healthcare professionals, but are at the moment still more in continuous education. So we're trying to update the workforce with these new visions, with access and use of technology on the one hand, but it does create the situation that we're always lagging behind, because at current moment still the majority of healthcare, mental healthcare professionals starting as new professionals still greatly lag these kind of skills and knowledge, and so it's something I take at heart personally, and it's something that is bound to change, but is going much slower than ideally it should. Yes.
Totally. Like, for instance, positive health is in a new curriculum of the medicine study, and it's still not. Everybody says, "Oh yeah, we already do it," but it's still the old biomedical model. People get the education, but the young group of people, they want something else. So we have all kinds of education besides the regular education organized now by students with courage standing up and saying, we need something else, and then we're giving lifestyle webinars and etc., all kinds of extra curricular programs, which it takes time, as long as the stakeholders, the professors, all the people who are looking for the old-fashioned way, the evidence-based, they first need like years and years data to be able to say, okay, we're going to also teach something different. It's a matter of time. I mean, it will be there, but it's really important. Yeah.
I would really continue to open the floor, but I also need to do some timekeeping. So maybe I think this proves that there will be room for fruitful discussions during the lunch. I would quickly want to give the word back to Wendy. There we are. To wrap this up, essentially, right? Can I? I can. Okay. Yeah. I'm going to go with two final questions, or two comments, because I can't differentiate. I'll let you go first. There you go.
I'll make it short. I just wanted to give a positive comment about the postmaster programs in Holland for psychologists who are incorporating innovation and leadership as a standard practice. So we're teaching with a few other colleagues of mine who's sitting here, and Arina, innovation for the postmaster programs for psychologists. So the upcoming generation is getting there.
Yeah, I agree. I've been in education before, and I think one small tip is just layer the education that's already there, the curriculum, with just some highlights already from start, and that can be an expert invitation from an innovative project or a company or anything. And well, I've been quite often on stage in different type of educations and programs, and the students love it because it's just a little thing, a little nudge. It doesn't have to include a whole new course, and if you layer your curriculum with just some spotlights, that's a good thing to get started growing. But that's just an addition.
I think Wendy was right, and thank you for these useful additions, right? So yes, yeah. All right, there we go. I've done my fair share of walking in the meantime, so I think that's a good thing.
Well, it's a question about the whole project of Super. First of all, I was thinking I'm working in early intervention for personality pathology, HYPE program, and it's a program that came from Australia. And one of the first things we implemented was user participation and co-creation with our young people. In doing so, we have quite different things that they think with us from the Australian platform. And I was thinking, is that a part of the Super project as well, to think about international differences? Because you will have international regulations and rules in privacy, etc. So I was wondering, is that a question that you're also going to study?
Thank you, Christel. Yes, this is one of the big questions. We also have the cultural differences between the countries. How will it work if a Dutch app will go to Denmark? Will it be cultural adaptable, or do we need to make changes? And also the Safe app from Denmark will go to us. I hope with your young patients, for example. And then we need to see if it's fit for Dutch culture. So I think with every tool you bring abroad, you need to think about the audience you bring it to and ask them if it's fit for them.
And maybe to add one more thing myself, and that is indeed at the core of the Interreg program as well, that we want to facilitate this transnational collaboration and uptake of tools, and that we see that across the whole of the EU and also particularly within the North Sea region, that great things are being made and implemented but don't necessarily make their way across borders for a variety of reasons. And so trying at the very least first to tackle the co-creation process to make it more acceptable, culturally adapted is one thing, but exploring, for example, differences in regulations and how we can, well, to some extent overcome this by overarching EU frameworks is part of that as well. So I think we are in for quite a ride for the next 18 months or so, and we'll be happy to keep all of you posted along the way as well. We're now good to go, Wendy. You're good to go, yeah. So yeah, the floor is yours again.
Thanks very much, Tom. And I think we're already seeing a lot of co-creation, and of course the final step in the design thinking process, I understood, is the testing. And I think, you know, this was a new format for us, but you all showed up. So I really want to thank you for all being here. As I think, yeah, also looking at the questions, there are still many to come, but we have a lunch hosted by GGZ Centraal. So please continue after we stop speaking. We'll also be here, so any questions for the speakers, any questions for any of us from Task Force Healthcare, please reach out to us. And then, of course, afterwards, all slides will be shared as well. So let's continue, let's say, the co-creation and the connecting as an ecosystem. I would really like to also thank, of course, GGZ Centraal for hosting this. I think it's quite a very nice venue, being here on your location. And I also want to very quickly ask for the expert speakers, if you can join me again. We have a very small present, just thanking you for your collaboration. Thanks, I think it was quite valuable. Here you are. Thank you. And if we can also have the super team again. As Yvette and Tom already shared, of course, also during lunch, the super team will be present if you have not registered yet, but you have an interest to further participate and be on their expert panel and engage in the further program. Of course, this was the kickoff today, but of course the project will last for 18 months. Then, of course, you can approach them directly today or after that. Thanks very much. Yvette, here you are. Thank you. Thanks, Tom. There you are. Thank you.
And thank you, Wendy, for hosting us today.
Thank you. Yes, thanks. Very welcome.